So the question is, what is a health share? A health share is similar to health insurance in that it is responsible for paying out for catastrophic type events, hospitalizations, surgeries, major medical expenses is the purpose of a health share. But the way that they do that is quite a bit different from how a health insurance does that. Health insurance is a federally and state level regulated entity that has to have risk management and has to have a certain level of financial liquidity to pay for any major expenses up to a certain amount. And, they essentially have to pay an unlimited amount after a certain point, and they have to have a whole series of regulations to make sure that they can always do that. Now, even though that is their responsibility, they always find loopholes to not pay for things, so I think we all know that. But health shares are different. Health shares are based on, originally, they were based on the Christian health ministries, and essentially a group of like-minded individuals decided to pool their money together, and if anyone in that group had a catastrophic event, they would disperse it to them as needed. It's a great way of pooling resources. Now, its original inception was based on the health share ministries. So they were originally developed by the Christian ministries. And there can be a lot of religious and moral guidelines of how you live your life that could come into play for a patient that may make obtaining a health share impractical for you. And a lot of it has to do with things like, do you smoke? Do you drink? Have you had premarital relations? Have you done this, that, and the other? And if they disagree with the way you live your life, oftentimes this can mean a denial of a claim. Additionally, health shares are not regulated in the same way that health insurance is. This means that they can essentially run these things however they want, and there's no real oversight to it. There have been negative reports of some health shares who the administrators and CEOs are walking home with 80% of the income and getting $1 million homes and denying all the claims. It happens. But also, there is a big understanding that health shares are not obligated to pay for everything that occurs to you. And the way they get their money, again, is by pooling their resources from their members each month and then distributing it. Well, they don't have to have financial risk. If all of their members contribute $1 million for that month, but you, after a major accident and surgeries and 6 months in the hospital, have a $5 million bill, they don't have to pay that. So it can be scarier for patients who if you have a major catastrophic event that goes above and beyond what a health share can pay, you might get stuck with a bill. That being said, health shares are often a fraction of the price of traditional health insurance, where a health insurance, for example, is running $300 to $1,000 a month or more, depending on your age or pre-existing conditions. Health shares might be running $100 to $200, maybe a max of $300 a month, with an unshareable amount, deductibles to go with it. And they are often more attractive as a financial savings tool, still doing the job, and especially when paired with a direct primary care practice, short of a major life-altering catastrophic level problem, they can be very effective for patients. Personally, at Starlight Health, we typically will recommend patients to go to specific health shares. Our favorite is either Sedera, which is a secular organization, which means there's no religious moral guidelines that goes with it other than live a healthy life. There's also, we've had good reports with Zion Healthshare, which has been pretty good. We've had a lot of patients rave about that one. But those two are really the only ones that we would typically recommend. And even then, we are not an affiliate for Zion. We do have contracts with Sedera, and that's part of our practice. You get discounted rates by going through us. But you really need to read the fine print and determine if it is right for you, the patient. You need to be very careful when it comes to pre-existing conditions, and you need to be very careful when it comes to things like drinking and smoking and other kinds of lifestyle choices that may cause a denial for a Healthshare. So if you have any further questions, please feel free to email or text me. You guys have a wonderful day.